I've lived my whole life totally blind. Ray is partially sighted, so that means he can see a little bit. I always say well enough to ride a bike.
When Ruth was born, she was just like any other baby. And as she got a little bit older, she started having digestive issues and we had to take her into the hospital. They diagnosed it as chronic intestinal pseudo-obstruction. I didn't put a whole lot of thought into it when the other company said they couldn't do it because it felt like it was just another one of those setbacks that you almost come to expect.
When Quorum came into the picture, they had a lot of confidence in their abilities to be able to train.
Quorum sent one of their nurses to our hospital room 2 or 3 times a week. And she would just work with us. Here's the parts, here's what they look like, here's how they go together.
They taught us properly how to be aseptic, use proper technique, so that way we wouldn't contaminate the line.
Instead of just visually showing how it's done, they had actually us practicing it. The whole system just made both of us feel like we had the confidence to take care of this.
I would say it's like Quorum and their staff is like family. They call you every week. They ask you what you need, what supplies.
The 2 hospitals and Quorum work extremely well together. There's all this work that goes on behind the scenes that we don't even have to think about. It's absolutely amazing to me. I'd say Ruth is doing amazingly well. What's most important is that she has a great quality of life. I don't want her to miss out on opportunities. I don't want her to be defined by her condition.